Today I'm pleased to announce the addition of Dr. Jeff Pope to our orthopedic practice. Dr. Pope, like myself, is a native of Bergen County, New Jersey, fellowship trained in sports medicine and arthroscopy. He trained in New York City and did his fellowship training in Chicago at the University of Chicago. We are pleased to have him on board and look forward to his contributions in continuing to provide outstanding orthopedic care to our community. I'd like to take this opportunity to ask Dr. Pope to elaborate on a patient's radiographs. A patient of ours who recently underwent hip arthroscopy for a condition known as femoral acetabular impingement.
Here are two common views of the patient's right hip. What we see in these views are a very minimal amount of arthritis. You can still see a good preservation of the joint space. We see calcification within the labrum here, a prominence of the socket, as well as a prominence of the ball. Look on the other view here. The prominence of the bone here, which is abnormal, as well as the excessive bone on the socket, cause mechanical impingement, limiting patients' hip motion, most notably when they're flexing their hip, such as in getting in a car or tying your shoelaces, as well as turning your hip from side to side. This can lead to groin pain, snapping, popping, clicking, and limited motion.
Although the x-rays are very helpful in making the diagnosis of a labral tear or femoral acetabular impingement, nothing is more important to us than performing a physical examination and taking an appropriate and adequate history from our patients. In addition, sometimes these radiographs are not enough to formally make the diagnosis of femoral acetabular impingement and labral pathology, and as such, very often we have to order an MRI of the hip to help definitively make the diagnosis. In that regard, if you or a family member feel that you may be suffering from an intra-articular problem in the hip joint itself, or if you are complaining of such symptoms as buckling, giving way, locking, or loss of motion, or groin pain, please feel free to make an appointment with either Dr. Pope or myself to further assess your condition and come up with an appropriate course of treatment. In the era of social networking, we're pleased to announce now that you can follow us on Facebook, Twitter, and LinkedIn by searching Kayal Orthopaedic Center.